one of the most important dimensions of the color. For sure, when we want to restore in a direct way a tooth, one of the aspects of the color that we are very focused on is the translucency. Not a lot when we are restoring a posterior tooth or maybe the cervical area of an anterior tooth, but absolutely when we are in the area of the incisal third, we have to be focused on the capture and to analyze the translucency that we want to reproduce, especially if we are on the central or lateral incisors, and then we have to decide the better strategy in order to reproduce it. For sure, when we are working in an indirect restoration, we delegate to the technician these aspects, but as a clinician, we have to be focused on the type of preparation that we do in this area. But I don't want to stay on this aspect today. We will talk maybe in another video. What I want to talk about today is the direct approach when we have to remake this kind of natural translucency. How we can perform this kind of translucent effect in the anterior direct restorations. We have a lot of contribution from many authors, Vanini, DBDC, Newton Fall, and others like Federico, for example, and many others that we cannot cite now. Anyway, we can approach, for example, dual layering techniques, so we can have a main dentinal body, and then we apply enamel buccal layer, and in this case, we are not very able to reproduce a very high translucent effect, because in the incisal edge you have a quite opaque area in this case, and maybe you can reproduce a tooth that has not this kind of situation in a natural condition. But when we have a young tooth, for example, we want to be focused on it. And so usually in our protocols, we use this kind of approach. So we do 3 layers mainly: buccal enamel, palatal enamel, and in intermediate dentinal body. When we watch this incisal part in this kind of buccal point of view, we can interpret it that we want to have some mamelons, for example, and in between these mamelons that are made with some dentinal body, we can apply something. We can put enamel, so in this area we have enamels that is absolutely passed through from the buccal to the palatal, so we have a total thickness of enamel material, and this is very helpful in order to have a very high translucent. Only in some cases where we have this kind of effect very extreme and very represented, we can use palatal enamel, buccal enamel, and as in a sandwich, we can put in between some translucent effect. So this kind of translucent enamel, or polished enamel also called, are quite transparent, similar like a normal glass. And so when we put something in between like this, we can really emphasize this kind of effect. So remember, summarizing, when we have this kind of interest to reproduce this high translucent effect, we can have a total thickness of enamel, or we can have buccal and palatal enamel, and we can have in between some translucent. This is the sharing of today, and we have to remember that in the young teeth, this is very important.